Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about what it could potentially mean if there is no fetal pole seen at your first ultrasound scan. Now, long story short, this could basically mean one of two things. Either one, you are too early to see the fetal pole on ultrasound, as in you came in a little bit too early in your ultrasound scan to be able to see anything, or two, it could be because of a miscarriage, and that is why we are not seeing the fetal pole on ultrasound. So let's focus on scenario one for right now. And this is if you come in a little bit too early for us to be able to see the fetal pole. In general, the fetal pole on ultrasound does appear at around 5.5 to 6 weeks, and the fetal heartbeat is going to appear at about 5 weeks, 5 days. That is the earliest that we can see it on ultrasound. Now, if you come in between that time, so basically that 5 to 6 week gray area, then we might not be able to see baby because baby is just too small at that point, even with an internal ultrasound. So you come in for that ultrasound at that time and we don't see anything. That's not necessarily because it is something that is wrong or that you are having a miscarriage. It just means it's too small. Our technology hasn't advanced to the point yet where we can see such small cells. So at that point, you are going to go ahead and just go for a follow up scan in about 2 weeks' time. Well, basically 11 to 14 days' time, depending on what we saw at that first scan. It's going to be a little bit shorter if we see a yolk sac, that's going to be an 11-day follow up, versus if we just see a gestational sac with no yolk sac, we are going to see you then in 14 days' time. And in Canada, where I work, we always strongly encourage patients to come in between 7 to 10 weeks for their dating ultrasound. But because of people that have a history of losses or think that they are actually further along than what they are, etc., we do still scan those that come in between that 5 to 6 week mark. And a lot of the time, they are just too early to see anything. And then we end up doing a follow up in 11 to 14 days' time. And then we can actually see baby at that point, and everything is all well and good. Now, let's talk about the second scenario. And this is the scenario where it is actually a pregnancy loss, and that is why we are not seeing the fetal pole. So, when there is a miscarriage or a loss in the first trimester, a lot of the time it happens way too early for the woman to even know that she's pregnant. But some of the time it is going to happen kind of early on in that first trimester. So instead of us being able to see a fetal pole, we either see nothing and then it ends up progressing to nothing still, or we see what we think is something without a fetal heart rate. And then when they come in for their follow up scan, it is either gone or there is still no fetal heart rate detected. Either way, though, this still means that we are having a pregnancy failure in that first trimester, and that is why we did not see the fetal pole. But the tricky thing about this whole thing is we don't really know what scenario you are in. Basically, either you're too early to see or it's a pregnancy failure until you come back for your next ultrasound follow up. Even some women who then end up having bleeding and concerning symptoms between that first scan and the second scan, sometimes they will come back in at their second scan and there is a perfectly normal looking pregnancy in front of us on the screen with sometimes a subchorionic hemorrhage that would explain that bleeding. But essentially, you are just going to have to play the waiting game if you have had a empty sac for your first scan. And I know it is not ideal for a lot of people when you are waiting for such a long amount of time between your first and second scan, but we do have those guidelines in place just to ensure that at your second scan, we can definitively call if it is a normal progressing pregnancy or if it is actually a pregnancy failure. So hopefully this video has been helpful for you. As always, please like, comment, and subscribe to my channel. And if you like my content, then I do make videos every Tuesday and Friday, and I also make videos over on TikTok too. So check me out over there as well.